Hi guys, welcome to the Knowittoo Podcast. Today is going to be a great day. We're going to be talking about something so interesting. I mean, it's also embarrassing too, but come on, we need to talk about this thing, yeah? So we're going to be talking about mouth odor. Did I hear someone say, ooh? Yeah, I know it's relatable. I know we have had experiences with these things. I know that it could have been you, or maybe you had a friend that the odor was, or the odor from her mouth or his mouth was so terrible. But then that's why we're here, yeah? We're here on Know It to know it too, and to learn, yeah? So I'm not going to be doing this alone today. Come on, I have someone, a friend of mine, a doctor, a dentist by profession, Dr. Tomiwa Adedire, and he's going to be educating us on mouth odor, what to learn about it, how we can go past this, and how we can get better. Okay, so I would like to shine the camera to my friend, Dr. Tomiwa Adedire.
Hi everyone. Hi Marian.
Hi,
Thanks for
Doc.
having me here. I'm glad to be here on this the Knowittoo show.
Yeah,
Thank
it's
you.
it's a pleasure. It's a great pleasure having you here. And just before I thought about this topic, I really had it in mind to know who would be the best person to fit in for this topic. And come on, a dentist to really be the best person because I need his knowledge. I need to understand what to do about this. I mean, I'm saying I know you also would relate with this too. Yeah, we all need this knowledge. So I guess we're asking, or just it's going to be a conversation anyways. But then there'll be a series of questions that we could learn from, and we'll be getting answers from him too. Okay. So now this mouth odor, it's a problem that we might have experienced on different levels. So probably we had friends that had it, or we were the ones that had it. Okay, so what exactly is mouth odor? Can you explain it for us?
All right. Mouth odor, also called bad breath or halitosis or fetalis. That is, it has a lot of names, and is I would define it as an unpleasant odor arising from one's breath or from the mouth, because actually most of the odor comes from the mouth.
It's actually the major problem in some people's lives right now. But then, whatever problem it is that is out there, there is always a solution. Yeah, so that's what we're here to learn. So this mouth, this bad breath that you mentioned now, what exactly causes it? What is it? Is it genetic? Is it something that if the father has it, the child will have it? Is it something that is avoidable? What exactly causes this bad breath?
All right. Bad breath has an array of causes, a lot of them, but I'll pick on some very common causes. The most common cause of bad breath is poor oral hygiene. When you don't take care of your mouth, when you neglect your oral hygiene, then you are prone to having this bad breath. So that's about 90% of the causes of all the bad breath we have is due to poor oral hygiene. Then the cause can be from the mouth or from outside the mouth, that is other parts of the body. From the mouth, we talk about poor hygiene, which will come in form of tongue coating. You know, some people, when they brush, they don't brush their tongue. They just leave their tongue like that. When you check their tongues, oh boy, you think you are in a pit. You know, it's so terrible because they just neglect it. They brush their teeth. You know, some of them they even do it vigorously, but they leave that tongue. They
Yes.
believe, let me not hurt my tongue.
Yeah.
Let me leave my tongue. No,
Yeah.
because of that, there's been a lot of accumulation, a lot of coating on the tongue, and this coating will allow food debris to pack under, and bacteria, those small organisms, they begin to act on those food debris on the tongue and in between the teeth. And once they act on this food debris, they begin to produce what we call volatile sulfur compounds. So that's the common one from the oral cavity. Then it
Okay.
can come from other parts of the body like lungs, someone with upper respiratory tract infection, you understand, lung cancer, bronchiectasis, and some other diseases that affect the lung. It could come
Okay.
from the liver, it could come from the kidney. Diabetes could cause mouth odor. So mouth odor has a lot of causes, but the major one, just as I've said,
It's the
is that
poor
poor oral
oral
hygiene.
hygiene. Okay, so let's just hold on. Let's just hold on a bit there. So there was something that he said that really caught my attention. You know, some people you see them brushing their teeth, or rather, you hear them brushing their teeth, and it's like it's a war going on there. There's a lot of scrubbing going on there. So you get to understand that it's not just about brushing the teeth alone. So people are so vigorous in brushing their teeth, yeah. But it's not just about that. The tongue too is also there for you to clean up. I mean, that's the major thing that smells, yeah. I remember growing up, my mom used to tell me that it's not the teeth that smells, it's the tongue that smells. So you should brush your tongue, okay? And then there was something you just said now that I would like for you to emphasize on. You said that there's some people that have mouth odor, but they do not not know that they have it. Is that possible?
Yes, it's possible. It's possible for someone to have mouth odor and not know. For example, if you ever seen some people living in the slum, if you ever pass by, you say, "Oh my God, this is so smelly. This place is so bad." But to them,
They are
you see,
used to
it's
it
their palace.
already.
It's their palace.
Okay.
They are used to it.
Oh,
You
okay.
understand? So over time, their body has a way of adapting to it, and they just feel everything is normal. You understand? Some people have bad breath, they have body odor, but they don't know they have because they're used to it.
Yeah.
It has become part and parcel of their life.
Wow.
So if you do something over and over again, you just get used to it. You don't say anything bad with it. So I think that's one of the issues people have. And some people, they are just negligent about their health. You understand? So they don't even care. Like, it smells okay. Who don't want help? You understand? Some people,
It's
some
killing
people
people. It's not about who it helps, like it's killing people.
Yeah, exactly.
Yeah, so it's just sad to take note of the fact that people are negligent about their health. So
Yeah.
that means there are actually people that they know that they have bad breath. Probably some people have maybe hinted on it because even there's a problem. The problem there is even to tell someone that, oh, I'm not comfortable with your breath. Like, how do you even go about telling people? It's quite a sensitive topic
Yeah.
to even lay bare. So how do you even mention it to someone? Because some people might really be ignorant, sincerely be ignorant about it. So how can you even add that or bring that up in a conversation?
It depends on the kind of friendship or relationship you have with the person, the proximity you have with that person. For example, if it's a random friend, you don't want to lose the relationship or the friendship. You want to be careful. You don't want to insult them. You don't want them to feel embarrassed. You understand? Because this bad breath can even affect mental health of individuals affected. It has been documented. It's associated with depression, social anxiety disorders, even suicide.
Really?
Yes.
Wow.
So you want to be careful. You don't want to run anyone down. You get? So there's a way you can do it. If you are close to the person, you can even call the person for a date. Just hang out with the person and just use, some methods. It could be you could paint a scenario. You understand? Because whether you like it or not, if you don't tell them the truth, there's somebody that is avoiding them because of that bad breath. It might be
That's
their
very
it
true.
might be their
Yeah.
husband, it might be their future, their potential husband. If it's
Pay
a
attention.
lady, it might be potential wife, if it's a guy. It might be a business partner.
Yeah.
It
Yeah.
might even be, some people, they are going for job interviews and they are not employing them. It might be one of the reasons. Because maybe, for example, you want to employ a marketer now and the person's odor is bad. At the point of interview, you just, okay, don't worry, we'll get back to you. Is that serious?
Yeah.
So you have to find a way to communicate to them. If you are not that close to the person, you can get someone that is close to him or her to hint them about it. And don't just tell them about the problem. Tell
Provide
them the solution.
solution.
You
Thank you.
understand? It's very
Yes.
important. Tell them
Yes.
what to do.
Yes. There's something called constructive criticism. So you're not
Exactly.
just coming to condemn or make the person feel bad about the current situation. You're
Exactly.
also bringing a solution for them to
Yeah.
help them, okay?
Yeah.
And I think it's the major thing is the manner of approach.
Yeah.
Yes, the manner of approach.
Yeah.
It's not about what is being said sometimes. It's about the way it is said, okay?
Yeah.
So how you communicate what you're communicating really, really matters
A
a
lot.
lot. So however it is, you need wisdom, you need discretion to go about it. Because if you truly care about this person, like you rightly said, marketing, marital affairs, relationships can be broken because there's going to be a bridge in communication. You don't want to talk to this person, not because you don't like this person, but there is a problem. So if you really care about that person, you would need to make that move, but you still need to take note of the manner of approach, and you should also prefer a solution politely still. Okay. Yeah, so that's something I've taken note of. Thank you very much, Dr. Tomiwa. So another thing I would like to ask now, what do you say about breath mints? I'm talking about the usual commercial breath mints that we have, Tom Tom, Baba Blue, and then some mouthwash too. Do they prefer complete solution? I'm saying complete now, or what do you say about it really?
All right. Before you can treat something, you need to know the cause. You understand? And those things are not meant to treat mouth odor. No. You understand?
Okay.
It's like you have a broken pipe and water is leaking from the pipe. The room is flooded.
Flooded.
and you keep mopping the room,
That's not the
that's not the solution.
problem.
You
Yeah,
understand?
that's not the
So as you mop, the room
issue.
gets filled up.
Yes.
Because you have not resolved where the problem is coming from. So you have to know the cause. You understand?
Yeah.
Eventually, you have to mop up that place. You understand? But you are not. That's not the primary solution. The primary solution is halting, or stopping the water from leaking from that pipe.
Yeah.
That's the first thing to do. Then you can now mop up. So those things are not meant to cure halitosis. They can refresh your breath for a while. Afterwards, you go back to where you are coming from. You go back to the initial state of bad breath. So we must be very very detailed
Okay.
about these things. We must know what we are working with. Those things will not cure bad breath. You understand? So and I spoke about different causes. Some people think they have bad breath and they don't have bad breath. You know, they don't. It's just in their mind. People around them cannot perceive it. So it's a psychogenic circumstance. They just think they have bad breath. Some of them, they might have had bad breath before, and maybe after the bad breath was treated by a dentist or a doctor, someone who has expertise in managing it. So afterwards, maybe 6 months after, they might just feel, oh, they're having that bad breath again. And in the real sense, there is no bad breath, no mouth odor. So it's just halitophobia. They are afraid
They're
of
scared about
having that mouth odor again. So, and some people, they never had, but they just have it in their mind. It's just, that one is usually due to mental disorder. They just think they have bad breath. They never had before. Nobody ever told them. The people are not uncomfortable around them because of their breath, but they just think in their mind that they have it. So the management of that will be different from the management of bad breath due to poor hygiene. So, but the dentist has to assess to determine or to discover what is actually causing the bad breath, so that they can prescribe appropriate treatment or make appropriate referral to a mental health specialist.
All right. So from what you just said now, we can see that mouth odor is just beyond what is happening in the mouth.
Yeah.
Okay. It could also be caused by health conditions. I know you mentioned the lungs. I know you mentioned cancer. And you also said something now relating to mental health, that it could also be a psychological issue. So
Exactly.
it's possible that they have had the bad breath before and it was treated. I'm just going back on what you said. That it was treated and they feel like it's present again.
Yeah.
And it's possible that they don't even have it at all,
Yeah.
but they just feel like it is there. So now that leads me to this question. So is it possible that someone could have treated bad breath before, that as mouth odor? You also called it halitosis. That's a medical term for it. So now someone has treated it before. Is it possible that it can resurface again?
Yes, it's possible.
Okay.
It's possible. You know, I already said that most of these causes is due to poor hygiene. If you don't maintain your poor hygiene, and you should note that just brushing twice daily and flossing cannot help keep your mouth clean all through the year. You need a professional cleaning, because there are deposits on your teeth that just brushing cannot take off and will never take off. You understand? So we should note that visiting your dentist every 6 months is also one of the ways to prevent this thing. So if we've discovered the cause, and halitosis, it could be a disease and it could be physiologic. It could just be normal. For example, you wake up early in the morning, you discover that your breath is smelling.
I was going to ask about
That
that
one
too,
is
yeah.
physiologic. There's nothing bad about that. But it's worse when you don't brush before you sleep in the night. If you don't brush before you go to bed at night, when you wake up in the morning and you try to perceive your mouth, you know that, see, oh boy, this thing is really, really...
It's oozing.
Yeah, exactly. That's the word. So that's it. So brushing before you go to bed at night can help reduce that level of odor. It's still normal. It's normal for you to have that. Then eating some of the referral substances like onions, garlic, those things can cause mouth odor. But those things themselves, they are not causing any disease. So halitosis or mouth odor in that regard is not a disease. It's just due to what you have eaten. And over time, the breath will the mouth odor will resolve. Yes.
Okay.
As the day goes by.
Yes.
So that's we must know that. Yeah.
Yeah, I think I can really relate to what he said about when you brush at night and when you don't brush at night. I've been on the two extremes. There are times I've gone to bed. In fact, several times I've gone to bed without brushing at
Yeah.
night, and I know that the breath in the morning is worse compared to times that I brushed the previous night.
And you know
So
why?
yeah, because I cleaned and the food debris and the bacteria is
Exactly.
reduced. Yeah, that's why.
Exactly.
So I just got
Exactly.
something now.
Yes, because if you don't clean, naturally at night, saliva production is reduced. It's not as high as what you have during the day because the more you talk, the more saliva you produce. But because you are going to bed, you are going to sleep, you are not talking, your mouth is shut. So the saliva production is reduced. So if you didn't brush before you go to bed, you would have you would have those food debris packing between your teeth and on your tongue, and bacteria will act on them. So they will eventually produce the volatile sulfur compounds, which are responsible for mouth odor. So that's one of the reasons, or those are the reasons. Let me put it that way.
So it makes it seem like the saliva has a cleansing property.
Exactly, it does.
Oh,
Yes.
okay. Okay. You see why I brought my friend here? He's so knowledgeable about this topic, and enjoying I'm really enjoying getting this stuff from him, and I'm sure you're also enjoying it too. So now, with what you have said, now you have recommendations for us to see a dentist 2 times in a year. You said six
Every 6
months.
months,
Every
yes.
6 months. So that's also the same case with someone that already has this mouth odor. He should see a dentist
Yes.
first to understand what exactly is the cause, and he will be able to take care of it. So now, how long would it take for the mouth odor to clear up when it's already been attended to by a dentist?
Okay. You know, if the cause is poor hygiene, once you take out those things, almost immediately the odor will
Are
disappear.
you serious?
Yes, it's as simple as that. I
Wow.
remember I got a call some months back, and the person just called me that, oh, he's been having this mouth odor, whatever. I said, okay. You see, it's very simple. The major cause is poor hygiene. Go to a dental clinic, let them clean your teeth for you. Get this mouthwash, use it. I gave him the prescription. It should not exceed 2 weeks. And that very day, he messaged me that, oh boy, the odor is gone. Oh. So
Wow.
if it's due to poor hygiene, then believe me, you are fine. But if the person has poor hygiene, you've removed those things causing poor hygiene, and the odor still persists, then you should know that is beyond the poor hygiene. Then
Yeah.
there might be something else. So you want to look at. So that those are the things that your dentist will look at for when you go for your dental checkup. It will assess you. Do you have upper respiratory tract infection? Could there be something else wrong? Because from the odor of your breath, I can actually tell what's happening to you.
Okay.
For example, some people fast, and some take keto diet. Some people undergoing dieting, whatever. They take keto diet to lose weight. Those kinds of persons, they have a specific odor. People with diabetic acidosis, you
Acidosis.
understand? There's a particular odor they have. So once a dentist perceives this odor, or someone trained to actually perceive bad breath, you understand? The person will be able to tell if this is actually coming from the oral cavity, if
Or
it's from,
beyond that.
yes. Then apart from poor hygiene, some other oral diseases like gum diseases can also cause poor hygiene. Tooth decay can cause it. There are a lot of oral disease that can cause it. So 90% of the causes, as I have said before, and I'm repeating myself again, is from oral cavity, it's
Oral
from the mouth.
cavity.
It's from your mouth. So once you have to see your dentist,
No.
and if the cause is removed, then you have your normal odor back.
Wow. Thank you so much, Doc. It just keeps bringing to light that there is no problem that doesn't have a solution. And really, the solution might just be something not so big. You just have to make that step to go and see the dentist. And like he said, almost immediately,
Almost
it's
immediately.
resolved. Okay. So now some people are very superstitious. They think that when they have a problem, it might be spiritual. So you see that some of these things too, they are just maybe habits, and you just being much more conscious about your health and just checking with the dentist, and there'll be solution. So when they find out that okay, it's beyond the mouth, it's no longer something that has to do with the oral cavity, you refer to the
Yeah, so
managing team for that.
exactly,
Okay.
yes. So we might ask for other investigation to be sure before making referral. So, for example, you perceive someone's breath and you discover that this could be a kidney disease, a chronic kidney disease. Okay, you tell the person to do some baseline investigations. So if you see those values and you see that they are deranged, they are not within normal values, you know that, oh, this might actually be confirming what I'm suspecting. Then you make appropriate referral as a dentist to the um, renal
Expert
physician.
physician.
Yes.
All right. So this just points to the fact that at the end of the day, beyond just dental health and dental hygiene now, in general, it's good you go for regular checkups, because if you don't know your baseline, you won't be able to know when there is a problem. Okay, so going for a dental check can even help someone to know if there is something much more serious than that. Okay, so one more, or rather the last question I would like to ask now: are there home remedies? Are there things that you could just do, or herbs or substances, natural substances that you could put together and it would help reduce the bad breath? That's the last question.
Yeah, there are. There are. But they are supposed to be a form of adjunct therapy. They are not the mainstay. They are not
Main.
mainstay treatment for mouth odor.
Okay.
You understand?
Yes.
For example, we might prescribe mouth rinse for you to use, but mouth rinse will not itself cure mouth odor if you've not removed the cause. You understand? And you are not supposed to use it for long. You should not use it for more than 2 weeks if it's prescribed to you. Because if you
Okay.
use it for long, it has a lot of adverse effects, like it can cause tooth discoloration. It can even cause your gum to start peeling off, what we call desquamative gingivitis. It can cause parotid swelling. You know, that's your saliva, your salivary gland. You just keep swelling up. You understand? So there are a lot of causes. So we are very careful about these things. You know, people just think, oh, they just put one or two together and just, it worked for me. Then let me start using it. Then they get people into it. And you know, in this part of the world, we tend to abuse medications or home remedies, anything like that. You hear people, they just want to keep using it and using it and using it. And that's not so good for them. So just the normal thing is for you to see an expert. Let them prescribe what to use for you
All right.
and the appropriate time for you
All
to use it.
right. All right, thank you so much, Dr. Tomiwa. It's been a great time. I learned a lot, and I'm also very sure that you also learned so many things too. So, like he said, the bottom line of all of this is that you should go see your dentist, okay? Your dentist would tell you what exactly is the problem, and he will also prefer a solution. And remember, he said that it could also be beyond the oral cavity. So there could also be some other underlying diseases that could be happening that's causing the bad breath. Okay, so see your dentist and there will be a solution. Okay, so once again, thank you so much, Dr. Tomiwa. Great time, great time, great time. I learned, yeah, it's a pleasure really having you here. I learned a whole lot. So you should follow us on YouTube at the Knowittoo. So our videos are going to be uploaded there. So you should follow us there. You like, you share, you subscribe. You can also turn on the notifications so that you can get notified whenever we post a new video. And also on Instagram, so we'll be having some reels that'll be uploaded there as regards this podcast. So you also follow us to the same title, the same name. See you soon. Thank you so much. Have a great day.